Okay, nurses, so we're gonna do the second part of that, of priming IV solution. So we're gonna do secondary. So we already know what equipment we need. We need our medication, we need our tubing, we're gonna need an alcohol wipe, and then we have our labels and some gloves if we wanna use those, and a medication label as well too. So just like before in the other video, and if you have not watched part 1, go ahead and watch part 1 before you watch part 2. All right, so first thing we're going to do is look at the package, make sure it's not ripped. We checking the integrity of the package, make sure it hasn't changed colors or anything like that. We're going to go ahead and open it up. Now we have our medication, and of course we have an antibiotic piggyback. We want to check the expiration date. And then of course we have to check the medication 3 times. Okay, nurses, first time, where do we check the medication?
The mark to the order.
The order and the mark. Very good. And then we check the medication to
The mark.
excellent. And the third and final check is
The mark to the patient
and at the bedside with the MAR and the medication. Very, very good. So we've done our first and we've done our second check. So we also want to check the integrity of this as well. Make sure it's clear. We want to check for clarity. We want to make sure that it hasn't changed colors or anything of that nature. There's nothing floating in there that's not supposed to be floating. We would get rid of that, just like we discussed with the primary. Then we want to look at our secondary tubing, and it says secondary tubing on there, and that gives you the drip set as well too. And like I said in the previous video, if the doctor specifies something that he wants differently from what is stocked at your facility, he or she will say that, okay? So we're gonna check the integrity of the package as well too, check the expiration date, wanna make sure it doesn't expire, make sure it's intact, it doesn't have any holes, it's not wet or moist or anything like that. Then we're gonna go ahead and open it. All right, I'm gonna go ahead and throw that away. And with the secondary, you'll see you have this nice little apparatus with it. You have your tubing. Okay, now what did I say you have to do when you first open this up? Anybody remember?
Clamp it.
Close the clamp. Because if you forget to do that and you spike this, then the wire is gonna shoot out all over the place. And if you do that, you only do it 1 time. You'll always remember, okay? So we're gonna check our spiking, nice and intact. I'll put that back on there. All right, our drip changer. Check our tubing. Again, I'm looking for any rips or cuts in there. Looking good. Okay. And then we're gonna look at our poke, make sure that's, all right, good job. Okay, same here if you need to inject or add something to this. And then here is where we're gonna take this off. And we're going to throw this away because we're not nasty nurses. Okay, not on Auntie Kathy watch. Nope, 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 nope. So we're gonna go ahead, put that in there. Twist, push, twist, push, twist, push. Good job. Okay, then I'm gonna go ahead and put that up here, like so, like that. Now, what did I say do next? Squeeze the chamber to that indentation there. Put some water in there. Then we're gonna open it up slowly. See that? Guys, see, no. And this one, we don't want to lose any of the medication because this is our piggyback. It could be an antibiotic. It could be an electrolyte. All right. So we have it. Now, as far as changing the IV tubing, you have to follow your facility's policies. Most primary tubing is changed every 3 days, so every 72 hours. But if your facility says 48 hours, then you do that. If your facility says 24 hours, then you do that, okay? But just know that most, you can use this for up to 3 days. The secondary tubing, most places you change this every 24 hours, and this has a lot to do with what you're infusing. Because some antibiotics are very, very, I would say, kind of harsh on the tissues, and it affects the tubing as well too. So you might have to change that every 24 hours. Again, you go by your facility's policies. Don't be up there trying to say, well, Auntie Kathy with the case said, no. You change according to your policy. But normally, this is every 24 hours, and the primary is every 72 hours, okay? And don't be a nasty nurse. You want to make sure you label your tubing. Because if you go into a patient's room and it's not labeled, then guess what you got to do? You got to assume that's been up there forever. So you got to change everything. And then the nurses after you are not going to like you. I'm telling you right now, they're not going to like you. So you always use whatever labeling that your facility has. So today is Friday. So if this was my primary tubing, I would change this on Saturday, Sunday, Monday. So I would put a little thing here that says Monday, okay? And the date and the time and your initials. And then this will be Saturday. I would change that one on Saturday. So if that was the tubing, then you just put it on there like so, like that. And put the information on there. Okay? So now we have both of them up here. Now we got to connect the two. All right? So, this is your primary tubing. This is your secondary tubing. One is shorter than the other, okay? Now, this little doohickey, we have to use it for our primary. And the reason why we're going to use this is we want to have our primary hanging down lower than our secondary. And just because by gravity, if somehow that this was to malfunction, this would go in before this would. But if we had them at the same level, the heavier solution would go in before that, okay? So you always want it to look like that, okay? The primary is lower than the secondary. Very good, okay? Now we got to connect it. So you have a series of ports on your primary. You have 1, 2, some of them have more. When you connect this, you have to connect it to the port that's closest to the bag. The port that's closest to the bag. The one that's right after the drip chamber. Closest, okay? So what we're gonna do is take an alcohol wipe. And we're gonna clean it. Like that. Very good. And then we're going to take this off like that. And we're just going to put this in there and twist it. Okay? Put it in there and twist it. And then it's just going to stay on like that. Okay? All right, so that is how we do a secondary, attach the secondary to the primary tubing here. Okay? And then the next video that I will be showing you guys is how to use a pump. But you have to remember, everybody's pump is going to be different. So what I would say as nurses, what I want you guys to make sure that you do when you get that new position as a nurse is make sure you get your training on your pumps. Don't just say, I understand, I know how to do it. Make sure you get adequate training and you are familiar with how to use your IV pump for your facility before you go and start giving someone some solutions and you don't know how to use your IV pump. So like I said, I will show how to utilize this pump. This is a very old pump, so you might not see this one out there. But again, make sure you get your training on the pump for your facility. Okay, so that is part 2. Make sure you like, comment and subscribe, which I already know you're gonna do. I already know you already liked. I know you already comment, and I already know you subscribe. So yeah, see you next time.